chronic homelessness is really focused on people with long-term histories of homelessness or multiple episodes of homelessness. And so what we see with the definition of chronic homelessness in older adults is that an older adult who is homeless or becomes homeless within 6 months really has the characteristics of someone who's been homeless for 3-4 years or longer. And so thinking about the definition of chronic homelessness specifically in older adults, the concern is there isn't a recognition of that impact on people's health that is different for older adults. There's a variety of considerations in thinking about primary health needs for older adults in supportive housing, as well as behavioral health needs. So really connecting to the health services in a community, whether that's a federally qualified health center or a community clinic or a care team that somebody is already connected to. So really thinking about primary health care and primary health needs. So that's important to talk through and how folks are going to access primary care. Also behavioral health needs. So that would span any mental health needs or substance use conversations with folks. And what are the supports and resources that are available to people that folks can really access, or is there a need to explore additional supports for folks in housing? And so there's a variety of ways those supports can be provided in supportive housing. It can be on-site with a resident services, case management that's located on-site, also out in the community, or a combination of both. And really thinking about the primary health needs, especially folks coming from homelessness who are older adults, often have significant unmet primary health care needs, as well as behavioral health needs. And really having a good conversation around what those needs are and how those needs can be met, either in the community, if they're in project-based development, or out in the community if they're living in scattered site, or are augmenting what's available on site at the supportive housing development. One interesting area of support around health is telehealth. And telehealth does provide access, is an important option for folks in supportive housing. And for older adults, really thinking about what's the technology that they'll be using. Is it a mobile device, or is there access to a computer? And then what's the internet access? And how stable is it? What does that look like for them? And then walking through the different platforms that providers use. So really thinking about the supportive housing team and what supports they can provide for folks who are connecting to services via telehealth. And also what's out in the community. Some communities have really great supports to provide access both to low cost or free Wi-Fi and internet connection, as well as devices. And so those things change over time, what those resources are in the community, and really figuring out what is that support needed for an older adult living in supportive housing to be able to connect to services through telehealth.